Sudden bladder urgency is a major challenge for men in wheelchairs who need to get to the bathroom fast.
Hi, I'm Michelle, and today I'm guiding you through pelvic floor exercises for men that are in a wheelchair to overcome bladder incontinence. So this is specifically for men that may be amputees, have arthritis, diabetes, heart disease, these types of conditions where training the pelvic floor muscles can make a big difference for both stress urinary incontinence and urge incontinence. Unfortunately, these exercises aren't for men with spinal cord injury or spinal cord related neurogenic bladder. So in terms of the best starting position, this is really important. So what you do is in your wheelchair, obviously first thing to do is lock your wheels down. Now, it's very important that your feet are on the ground when you do these exercises or feet are flat. You can see here that my knees are higher than my hips. So in this case, I need to lift the footrests up and take my feet forward so they're on the ground so that my knees are not higher than my hips. The reason for this is that we need to have the inward curve in the lower back. So men need to have your inward curve in your lower back for most effective pelvic floor exercises for addressing and overcoming incontinence. So what you then need to do is to lean forward from the hips if you can to create that inward curve. Now, if you're unable to lean forward, you can use a rolled up towel behind the lower back to help position and support that arch, that inward arch in the curve of your back. So that is our starting position, feet apart, knees slightly apart in that lean forward position. Pelvic floor muscles in men run between the sitting bones. So if you rock from side to side, you can feel your sitting bones. Now your pelvic floor muscles run between those two sitting bones. So if you look at the pelvis like this, sits down here, these are the sitting bones here. If you're looking underneath, this is the pelvic floor or the base of the pelvis. So they're your sitting bones. So you can find your pelvic floor muscles by rocking from side to side. They run between there and there. So they're a network of layered muscles that actually help to stop bladder leakage when they're working well. Here's the correct action and the correct cueing. There's two parts to this. The first part is to shorten or retract the penis, as if you're drawing it in towards your body. Now you can visualize a tortoise or a turtle pulling its head back into its shell. It's the same thing with your penis, so you're moving it inwards and it'll move slightly upwards towards your body when you contract, and then it'll relax again down when you relax. You'll also too want to tighten as if to stop the flow of urine once it's started. So you're tightening in and around the base of the penis to try to stop the flow and then relax it. So there's those two key actions there that you'll be doing, shortening and also to tightening. Let's have a try at that at home and see how you go. So remember that the buttocks stay relaxed here. We're not contracting the buttocks. These are internal muscles. Ready? All right, start now. See if you can contract. See if you can draw the penis inwards towards your body and see if you feel a bulge, slight bulge down behind the testicles, in between the testicles and the anus. Keep going, keep breathing. Keep your buttocks relaxed. And now relax and let go and have a big breath into your belly and out. How did you go with that exercise at home? This exercise, this pelvic floor exercise, can be really difficult to feel when you first start out. And let's face it, these are muscles on the inside. We can't see them from the outside. Fortunately, with men, there's some giveaways when the exercise is done correctly. The testicles might lift, but also too, the penis moves backwards towards the body and then moves back out again. Let's try that again, keeping the buttocks relaxed, keeping the breathing relaxed and normal. Breathing in. Now, as you breathe out, shorten the penis and tighten. See if you can hold just gently for starters. Keep breathing just gently. Get the action correct. And now relax and let go and breathe into the belly and out. So what we're trying to do is to use those pelvic floor muscles and train them for endurance. These are for long holds, for these first contractions. Now, I also want to teach you how to do some short power Kegels. These exercises are particularly helpful for stopping bladder leaks with coughing or sneezing and laughing, which is what we call our stress urinary incontinence. So let's do some power Kegels as well. Exactly the same action that I just described, but these are 1 second exercises and they're brisker and a bit stronger. So you're going to go contract and relax. See if you can do that with me as well. Here we go. Shorten the penis, tighten to stop the flow, and relax. And go again. A bit stronger if you can get the right technique, and relax. And again, tighten and relax. Let's do 2 more. Tighten and relax. Keep your buttocks relaxed. 1 more time, tighten and relax and let go. So we've done the 2 types of exercises there that you need to do. The long endurance holds, and they work to help prevent bladder urgency, which is wonderful. They help the bladder to store more urine. So very important muscles for you to be working and exercising regularly for bladder urgency. But these muscles also to then contract quickly to stop bladder leakage if there's a really strong urgent contraction of the bladder, or if you're coughing or sneezing. Now here's the trick. When you're doing your short, fast exercises, what you do, if you find that you're leaking urine with a cough or a sneeze, you contract those muscles before you cough or sneeze. So let's do this now. I'd like you to have a cough without any contraction, just a plain little cough, and you'll feel that outward pressure on the pelvic floor, and the anus tends to flare out a little bit. Now, contract the pelvic floor muscles the way I taught you. Shorten and tighten as if to stop the flow, and now cough. Can you feel the difference? There's less of that outward movement. And this is what we do for functional training to overcome stress urinary incontinence for men with bladder incontinence related to these weak pelvic floor muscles. So it's very important that you contract the muscles before and during the cough, before and during the sneeze. Otherwise, if you wait until afterwards, the show's over, it's going to be too late. So it's really important to train functionally as well. Now, how many of these Kegel exercises or pelvic floor exercises do you need to do to overcome urinary incontinence? Well, studies have shown that in men, the optimal time or endurance for the long holds is 10 seconds. Now, don't worry if you can't get to 10 seconds yet. Just take your time and build up gradually. These long endurance holds should be done 10 times in a row, and that's repeated 6 times a day. So that's quite a few exercises, isn't it? But you're building up to getting to that 10 seconds, and you're building up to getting to that 10 times in a row according to what you can do now. Now, the short power exercises that I talked about, those 1 second contract and relax, again 10 times in a row, but just 1 second, and again 6 times a day. So that is the dosage that we know that is most effective for overcoming urinary incontinence in men. So it's very important to know those details. Now, finally, how long until you notice improvements? Well, look, it can take, some men will notice improvements within a couple of weeks of starting their pelvic floor exercises. Other men, it will take, if the muscles are really weak and have never been used before, it can take 3 to 4 weeks, even up to 6 months to get full strength, because these are training muscles. Imagine if you haven't used a muscle group and then you're training it again, these muscles have never been used before. So it's really important to take your time, persevere, and try and do your exercises really regularly. So I really hope these pelvic floor exercises assist you if you are in a wheelchair or if you've got a mobility impairment, and that they help you gain more control and more independence in your life. Know that you can always get extra assistance from a pelvic floor physiotherapist. We can train you, help you, teach you how to do your pelvic floor exercises, and help you with bladder management if you're having difficulty with that and you need extra assistance. So coming up next, stay with me, there is a real-time pelvic floor exercise or Kegel exercise workout. And if you've enjoyed the video, I'd really be grateful if you can give it a like below, because then YouTube's much more likely to share this information, important information for men's health and other men with urinary incontinence that can benefit as well. Thanks so much for watching today. I look forward to seeing you in the next video. Goodbye for now.